Good afternoon, everybody. It's 12:30, and this is Dr. Ken Muich, Fibromyalgia Wellness Center, bringing you up to date with a lot of information concerning fibromyalgia. And this one's going to be really interesting because it has to do with a recent research paper. The paper was actually published April 30th, 2018. You might say, well, that doesn't seem to be very recent, but you have to understand that oftentimes what we have is research that comes out 6 months or maybe a year after the papers have been written. I wrote a paper for the integrated pain, and it took about 6 months for it actually to be published. Very, very happy to do that. That's great, but you can see where sometimes when you read things, it's not exactly up to date, shall we say? Not like the news we have today. We turn on our radios or our TVs, our cell phones, whatever, and lo and behold, we've got it right up to date. But this is about as up to date as you can get as far as research is concerned. So why is this paper important? It's called Fibromyalgia Syndrome. Still have a difficult time calling it a condition. A case report on controlled remission of symptoms by dietary strategy. It's very, very interesting. This paper, when I read it and I looked at it, I thought, well, let's see. I've been working with this protocol that we have very, very successfully, primarily as a dietary factor as far as treatment is concerned. And Dr. Saint Aman, my mentor, has been doing it for... So I've been doing it for over 30 years. He's been doing it for probably over 50 years. And yet a lot of the information that we have just doesn't seem to get out to people because our treatment is primarily non-pharmaceutical. The interesting thing about this paper is that it is also non-pharmaceutical. And yet they're making a big deal out of it, which is great because it follows very, very closely with some holes in it, shall we say, what we've been doing successfully for decades, as I mentioned. So it has to do with a 34-year-old young lady who suffered from a significant chronic pain. I want to go through some of these. I want to read some because this may sound familiar to many of you that have fibromyalgia. She had differential diagnosis of fibromyalgia based upon the presence of tender point sensitivity, 14 out of 18. That's not uncommon. Widespread chronic pain for more than 3 months. Again, that's one of the factors for fibromyalgia. Morning stiffness, non-restorative sleep, depression, anxiety, leg and foot cramps, chest pain, tachycardia, hypersensitivity to cold. We'll get on to that in just a few moments. Very, very interesting. Matter of fact, one of my recent talks was just about that, how weather has an effect on fibromyalgia patients. Cognitive impairment, the fibrofog, of course, as forgetfulness and low concentration, irritable bowel syndrome, prickling sensation of fingers and toes, bloating, and hyperhidrosis. So that probably sounds very, very similar to many of you out there. Here's this young lady, 34, and she has all these symptoms. Actually, they gave you a history. She apparently had surgery, but they didn't go into what type of surgery. About a year after surgery, she started having low back pain. Eventually, she, along with other symptoms, so she went in for an MRI, and it showed a disc bulge, but no other positive tests. That sounds familiar, of course. There are no objective tests yet other than, for her, the MRI for the lower back. Again, they did thyroid testing, very, very common for a while there. Thyroid was the treatment of choice for many people that ran from our protocol over to thyroid because of some doctors introducing it. That didn't make any difference either. The thyroid aspect in itself, findings were negative. And no help pharmacologicals. They gave the patient a lot of meds and so forth, and obviously the Lyrica, Cymbalta, Savellas, and all the other things that patients usually go under didn't work either. And so what they thought they would do is they would actually start a restricted dietary program. So just like ours, hypoglycemia or fibroglycemia, most patients have this sugar problem. And so Dr. Saint Aman actually called it fibroglycemia instead of hypoglycemia. And so we placed patients on a restricted hypoglycemic diet. What they did was they placed the patient on somewhat of a Mediterranean diet, but restricting heavily on all sugars, whether it be sugar or fructose, fake sugars, aspartame, dietary foods, and also I'm trying to remember. Oh, yeah. Corn syrup, things of this sort, anything that had sugar in it, they took the patient off of this. And within a very short period of time, lo and behold, patients started feeling better, along with the rest of the diet that they were on. And in about 2 weeks, and again, we have this show up usually with anywhere from a week to 2 weeks where patients start feeling better when we put them on this restriction. And within 2 months, most of the symptoms were gone. However, this is very, very interesting. I'm going to read this to you. So underlying the diet designed toward remission of symptoms, but not as a final cure. Okay, so they take care of the symptoms, but not the condition itself. That's what we try to treat, and that's the secondary portion of our protocol. The initial is the pre-protocol or the restricted hypoglycemic diet, very, very strict. And then it goes into the secondary portion, the glufenicin, which actually is the part that really finishes off the condition itself. So they also found that for placebo reasons, so you have to have kind of a secondary test to find out, was this just kind of a trickery or something? So what they had was the woman actually went back onto sugar, and as soon as she did that, the symptoms came on like a vengeance, and that's not uncommon. When we put place patients on our pre-protocol, we start taking them off of these inflammatory foods, so to speak. But when they go back on them, boy, they really have a bad reaction many times, worse than what they would normally have, and that's how the body responds and reacts. So they wanted to have this placebo aspect. If you go back on the sugars, would you have a reaction? Bingo. She had a reaction. Also, they found that seasonal changes, again, we talked about this on one of my talks just recently, seasonal changes had quite an effect. She felt a lot better with the spring and summer, but when it got colder in the autumn and winter, her symptoms then returned regardless of whether or not she was on the dietary aspect. And so, again, this showed an additional aspect as far as the problem is concerned. Again, I mentioned to you the history of the low back pain itself is an additional item that was problematic as far as the patient is concerned, and that they didn't really say anything about dealing with the back problem itself. So I mentioned to you seasonal changes, dietary aspect, and another thing that affected the patient was being doubted by her family, friends, and doctors that she may have something called fibromyalgia. And so this was also a kind of a sticking point as far as I was concerned, which makes a big difference. Okay, Leslie Harris just mentioned the glufenicin didn't help me. I was on it for 2 years. Might I ask you, were you under doctor's control or some doctor that knew about the protocol that would be able to lead you through this? Let me know that, because I'll cover that a little bit more in just a moment. I have found in one of my latest seminars, live videos that I gave, that I talked about this and how there are certain changes in the protocol that need to be actually looked at in a much more detailed fashion. So, no doc. Okay. Well, let me go through it. Glufenicin has worked for decades for my patients, if you believe it or not. You can call up and check, and I'll give you people that have gone through the protocol. The problem is those patients, and I've mentioned this before, that try to go through this protocol without doctor's assistance. The glufenicin, just others in fibromyalgia. Okay. The problem with this is that you don't have the direction that you need. Glufenicin is not something that if you read the book you automatically take twice as much You start at 300 milligrams twice a day. That doesn't work. Or if it works and you get worse, then you go to 600, so forth and so on, and then 1200. But that's where it comes in very, very important, especially like I had mentioned to the patients. For the first 45 days of treatment are extremely important. I found that you don't just automatically double 300, 600, 1200, and so forth. Sometimes it's 300 in the morning, sometimes it's 900 in the evening, or maybe 600 during the day, 900 in the evening, 600 in the day, 300 in the evening, so forth and so on. Sometimes you maybe just have one a day, maybe just 600 once a day. But that is actually found out by a very, very close relationship to the doctor that you're working with that understands this. So, yes, you are correct, Leslie, as far as it didn't work, probably because you needed someone to guide you through the amount that you were taking. And that is very, very important. Also, not that I'm saying anything that was probably a problem, but what about the fact that maybe you allowed some solicilates to sneak in somewhere where you're checking very, very closely? Not doing a blame game here, but there's a number of things that might have adversely affected you. Also, I found that guaifenesin does change. Sometimes fibromyalgia patients plateau. Say you're on 300 during the day, 600 in the evening, and then all of a sudden you're not really getting better and so forth. So what we do is we shake it up a little bit. We actually go up and down a little bit with the guaifenesin to find out what is the new level that you may need to take. And once you do that, then it really works a lot better rather than just taking and following sort of like a book type of a regimen. I found that those patients that may have had a little bit of a problem as far as the taking of guaifenesin, for whatever reason, it didn't work right away. So what we do is we move the amounts around a little bit. You're not stuck just like what Dr. Saint-Amand has put in the book. And I've checked with Claudia Merrick and so forth, and oftentimes they have to do the same thing. Now let me get back to, hopefully that answers your question. I went off on this tangent, but I think it's extremely important. I was very careful with solicilates. That's great. I'm so very, very happy for you. But again, just to repeat, if the guaifenesin was not working for you, it probably was because of the fact that you needed to adjust it or rebalance it a little bit, not just double it, so to speak. We found that works for a tremendous number of fibromyalgia patients. Remember, no two patients are alike, and if they're not alike, then we have to find another reason or another answer for the patient. And I found that adjusting the amount of guaifenesin up and down and so forth during the day, during the evening, made a big difference as far as the patients are concerned. As far as this seminar, the paper is concerned, the research paper. Okay, great. If I can be of any help, Leslie, let me know, please. You have to have a doctor that will be willing to spend the time with you, which I do, so that we can get you through this properly, and you're not wasting your time. And if there's any way I can help any of you, please let me know. But anyway, our protocol differs from that which this just pure dietary aspect is concerned. In looking at what they suggested to patients, I believe that the protocol that we have is a little bit more thorough. Just taking a patient off of any sugars is not the total answer. That's why we take patients off of sugar, gluten, trans fatty acids, and dairy for a couple of weeks, and then what we do is we add that one food every 72 hours to find out what foods that are really adversely affecting the patient. So you have to take it out of the diet for a couple of weeks before you actually add it to find out what kind of reaction that you have. And again, the reactions are like I've always mentioned to the patients in a joking fashion, like the 7 dwarfs: itchy, scratchy, sneezy, dopey, headachy, bloaty, all the things that are not normal. But if you eat this food, you'll have a reaction. Sweating, break out in a sweat, so forth and so on, itchy, scratchy. And so we think our pre-protocol is much more thorough in finding out what foods are actually blocking the patient and adding an inflammatory response onto the existing problems that they already have. And so that's we find is much better The placebo aspect, yeah, the placebo is built in. If you add that food to your diet that you know got you sick, you're going to get sick again. So that's a built-in placebo in itself. I also suggest to patients to keep a diary of foods that you're eating. Sometimes there's a tricky food that you're eating that is not part of sugar, gluten, trans fatty acids, or dairy. It could be another fruit, or it could be a vegetable. Not everybody can eat broccoli or asparagus or one thing or another. And the only way to find out if you're still having a little bit of a problem is then to start evacuating some of the foods that you're already ingesting. Look, here's another thing. We only eat about 15, maybe 20 foods are actually in our diet. There might be 1,000 different foods. Actually, somebody mentioned there could be 2,000 different foods in the world, but ours are so limited, so to speak. And so it should be easy to find out what of those foods is really causing the problem for you. You don't have to stop eating each and every one of them, but the easiest way to do it would be actually to find out if there's a food that, with a diet that you keep, if there's a food that you're eating that all of a sudden you have a reaction, look at what you had to eat and reevaluate those foods. Also, how you repair them. Is it raw? Is it al dente, cooked, fried, roasted, whatever? And what did you add to those foods as far as maybe herbs and so forth that maybe are affecting you? So there's just the little things I mentioned over and over again that make and can make a big difference. Also, ladies, also I would keep a record of your symptoms in relationship to menses, your periods, and whether or not you have a reaction from that. And whether or not maybe, just maybe, if you are on a pill or something, you might want to check and see what it's made up of, what are the basis of that, and if it has any salicylates in it, you may want to go to your doctor and ask for a different form of pill, that, and tell them that you're looking for something that is plant-free, not something that has plant-based involvement in it. And then the overall thing is that, this paper is dealing with the reduction of symptoms. And that's great. That's wonderful. But again, they're still not into the aspect of the actual condition itself. And that's where we come in, again, with the guaifenesin, which I believe if managed properly for a patient, it works. Believe me. So you may have to start out with just 300 milligrams once a day and see what kind of reaction. Then add another 300, but you have to wait for try it for like 3 days, and then add another 300 milligrams. So it'll be 300 twice a day, and what kind of reaction you have. Then maybe, and what you're looking for is a bad reaction. It's pulling the excess phosphate and calcium out of your body. Or then maybe add another 300 in the daytime, 600, and leave the 300 in the evening, and so forth and so on. So you want to do that a little bit at a time, or find a doctor that would be willing to work with you to make sure you work your way through this. Leslie, you are not the only person that has said, well, it doesn't work, the guaifenesin. And again, when I ask as far as what doctor they're working with, most of them are like yourself. I'm not demeaning you at all. A lot of people want to try this and see if it works, but it works best with the management of a doctor that is willing to spend a time with you, like myself, to make sure that you're not wasting your time and that you will get healthy as soon as you can. And that's what we're here for. So, very, very happy for the research paper that came out. It's sort of like eating a bite of the pie, not the whole pie. And so I'm going to send in information saying congratulations. I'm glad to see that you've actually validated what we've been doing for decades, so to speak. And if there's any questions on your part from anyone, I can't thank Leslie enough. As you see, if their questions come in, I answer them. And hopefully I answer this to your understanding and satisfaction. Again, this is Dr. Ken Muich, Fibromyalgia Wellness Center. I will not be having a live video next week. I'll be traveling. I've got to go to Chicago for some work, and during that period of time at 12:30, it just so happens I will be traveling, so I will not have a live video next week, but I'll make it up for the next week, that's for sure. That's exciting. This is number 29, by the way. 29 live videos that I have. So if you're interested in looking at some of the other information I discussed, go to the Fibro Wellness Center Facebook, and I saved each and every one of them so you can go back and look at many of the talks that I actually gave. Again, October 6 and 7, we'll be training doctors in Scottsdale at the Franciscan Renewal Center for 2 days for 12 certified educational units. All doctors need CEUs, and this will take care of it. Anyway, thank you so very, very much. Thank you for the questions, and I do hope I answered everything to your satisfaction. And we're very, very happy to see that this research paper came out to validate what we've been doing, like I say, for decades. Thank you very, very much. Don't be afraid to contact me if you like at the clinic. Bye-bye now.